Hello, I'm Dr. Chongwan Eldred, working with the Cameroon Baptist Health Services, precisely at Gwen Baptist Health Center. Following the outbreak of COVID-19, there's been a lot of information circulating, mainly on the social media and on other media platforms about the virus. So the information has been true, but there's a lot of false information circulating about the virus, mostly about the virus, how it affects people, how resistant people are, and I'm here today to kind of clear some of the doubts about the virus. To begin with, the first thing we've been told about the virus is that black people are not affected by this virus, which is totally not true. Okay, I mean, the virus broke in China, in Wuhan, but it has rapidly spread across the world, affecting Africa as well as the whites. So there is nothing like the black race is not affected by the virus because the blacks are more resistant. No, that's not true. We have had reported cases all across many African countries. As we speak, we have cases in Cameroon. So Cameroonians are black, so that's enough evidence to tell you that the black race can be affected by the virus. The second thing we've heard about this virus is that it affects the older people. No, that's not true. Alright, everyone is susceptible to being infected by this virus. There have been pediatric cases reported. So the virus affects all age groups, but then someone who is older with a comorbidity, maybe diabetes, hypertension, maybe a cancer or a chronic kidney disease, is more likely to have a severe form of the disease. Some people talk about the virus not being transmitted in hot, climatic or maybe tropical regions. That's not true. I mean, a lot of cases reported in Africa and sub-Saharan Africa, which has a very hot climate. So temperature has not been proven, or there's not enough scientific evidence to say that this virus is affected by climatic conditions. It's a respiratory virus that replicates in the respiratory tract before causing disease. So climate has nothing to do with the mode of transmission of the disease. Now, there's this talk about holding your breath for a number of seconds to see if you can last greater than 10 seconds, then you don't have COVID-19. That's really strange to know, because there are people who don't have COVID-19 but they have chronic lung disease. I'll give an example. Somebody with a disease called, let's say, chronic obstructive pulmonary disease may have a problem holding the breath for more than 10 seconds. Alright? Chronic smokers, people with lung cancer, they may have problems like that. So if we were to go based on that, those people may not be able to hold their breath for up to 10 seconds. It doesn't imply they have COVID-19. Athletes, for example, runners who are footballers, they can hold their breath. Swimmers, they can hold their breath for greater than 10 seconds. That does not mean they don't have COVID-19. Talking about the virus affecting the rich, well, it's a bit strange, because if you look at the mechanism of transmission of the virus, you already know that whether you're rich or you're poor, as long as you get in contact with the virus, you're going to be infected. Drinking alcohol or may kill the virus is not true. I just have to say a blatant no to that. Alcohol has not been linked with the virus. There's no scientific evidence to say that. Garlic and some traditional remedies, still not true. I mean, for us to be able to say that this particular thing is used against this infection, in our case, the COVID-19, there's supposed to have been scientific evidence, there's supposed to have been trials and things like that, which has not been done. So all the information that is circulating on the media about taking garlic and things like that is not really helpful, because as of now, there is nothing that has been attributed between garlic and the coronavirus. The herbal treatment, drinking a boiled mixture of lemon, lime, ginger, pepper, and so many other things, I mean, it still falls under the category of herbal remedies, which garlic was attributed to. It's not true. Okay, right now we are treating the virus is more of kind of symptomatic management and has nothing to do with all those herbal remedies we're talking about. Gargling warm water in the throat kills the virus. Still not true. Gargling warm water in your throat is a myth that people have come about on the social media, which really does not help us. And then there's a lot of people who have posted on their social media status saying that they are COVID-19 free, and when you ask how they knew, they said they'd been tested on their way from other regions into Bamenda. They got tested at Matazim. And when I found out, I realized that they thought this was a test for COVID-19. This is an infrared thermometer which is able to detect your temperature at a distance. And the advantage of this thermometer is that there is no contact. So even if we were to touch, we are preventing the auxiliary thermometer so that there is prevention of contact between individuals because of the fear of the spread of the disease. So this is just a thermometer that records your temperature and not really a test for COVID-19. So those are some of the myths that are circulating mostly on social media about coronavirus. I hope that this video has been helpful to clear some of the doubts we have about coronavirus. Thank you.